All right, doctor. A doctor who works for NBC, Dr. Fair, says he contracted the coronavirus, and the only way he can think of that he contracted is through his eyes. He says he was on a flight to New Orleans. He wore a mask. He wiped down everything. He was cautious. He was careful. The only way he can conceive, he says, of having contracted the coronavirus is through his eyes. It's the first time I've heard that you can contract it through your eyes.
Well, you can.
Mm-hmm.
I mean, that is a mode of transmission, definitely. It's normally respiratory, but you can get it in your eyes. That has been written in the some ophthalmological journals. That is a mode of transmission, definitely in your mucous membranes in your nose and your mouth. But yes, the eyes is recognized.
Then, Dr. Strom, why aren't we being told to wear some sort of eye covering?
Well, okay, let's get back to the inside of a house. Or if you're outside, you don't need that. When I do procedures on people, I absolutely wear eye covering and face shield.
Mm-hmm.
Okay, I mean, this is true. I would say if you are in close quarters and somebody is sneezing or something, I mean, some of those droplets can get into your eyes, and that's the cause of it. Should we be wearing something over our eyes? Well, I mean, absolutely. I mean, that is a cause of transmission. Why it hasn't been said? Because it's more commonly transmitted through the mucous membranes of the nose and breathing it into the lungs. And it also depends on the amount of particles. Now, look, you can have a little, let's just call them virons. These are floating little droplets. It depends on how much you're getting in. I mean, when you're breathing in somebody's sneeze or cough, you're breathing in a heck of a lot more than some into your eye. Now, what he's probably talking about, he probably touched the surface, he's thinking, and maybe he rubbed his eye. But, I mean, that's a very tough proof. How are you going to prove that? I mean, he can say what he wants. But if the question is, could somebody get it from their eyes or conjunctiva? Yes, the answer to that is yes.
Dr. Strom, Donald Trump says he's been taking hydroxychloroquine for about a week or two as a preventative measure, presumably to lessen the chances of him contracting the coronavirus. Is that sound? Is that sensible? Did his doctor prescribe it? And if his doctor didn't, how did he get it?
Well, I think his doctor probably prescribed it. Who knows how he got it? I mean, that's not recognized therapy. What is he going to take for the next 6 months? I mean, there's no proven benefit to that at all.
Mm-hmm.
So, I mean, I think he's probably taking it to prove that it's good because he said, what does it hurt? Maybe he's making a point with that. But so he's going to stop it for 7 days. Is that going to prevent this from him contracting possibly COVID in a month or two? No. Mm-hmm. So I wouldn't do it.
Carol is in Sarasota, Florida. Carol, you're on with Dr. Carey, Strom, and Larry. Go ahead, Carol.
Hi, Larry, I love you. Okay, years ago, I got conjunctivitis in my eyes. So therefore, I think you can get the virus in your eyes too. And I just want to say that I wear eyeglasses or sunglasses to partially protect my eyes. And I try to remember not to rub my eyes.
And Carol, you are an RN, right?
Yes, I am.
Okay, Dr. Strom, she, as you said, confirmed that you can get it through your eye, and the idea, I guess, is not to rub your eye.
Well, right, and look, you can get it. This virus, like other coronaviruses and flu, I mean, you could possibly get it in the eye. I mean, is it through a sneeze where there's some particles in the air and they're landing in your eye, or are you touching a surface and putting it in your eye? Who knows? It's good principle not to rub your eye, of course. And is this coronavirus, could it come from a sneeze or a cough? Potentially, yes. It's going to be hard to prevent that unless you wear eye covering.